Every 62 minutes, at least one person dies from bulimia or anorexia nervosa. While anorexia can and does affect individuals regardless of age and gender, the majority of those receiving an official diagnosis are young females. A 2016 study found, quote, anorexia has the highest mortality rate of all mental disorders. Young people ages 15 to 24 years with anorexia have 10 times the risk of dying compared to their same age peers, end quote. I find these statistics alarming for two distinct reasons. I have firsthand experience with anorexia, and my academic studies have been focused in children's and young adult literature, a combination of factors that inspired me to pursue the research, which eventually culminated in the creation of my thesis, titled Body Image, Imagining Bodies, Trauma, Control, and Healing in Graphic Memoirs about Anorexia. At this time, I am choosing to share elements from the chapter of my thesis titled Graphic Medicine and the Iconography of Illness, exploring the manifest, concealed, and invisible aspects of anorexia nervosa, specifically focusing on the graphic narrative Tyranny by Leslie Fairfield. I am, however, including images from the other two texts I discuss in my thesis, Ink and Water by Lacey Davis and Lighter Than My Shadow by Katie Green. Over approximately the past decade, there has been a noted increase in comics centralized around healthcare and illness. These graphic narratives, often referred to as graphic pathographies, illness narratives in graphic form, have been produced from varied perspectives, ranging from healthcare professionals to patients and their caregivers. Taking note of the apparent trend, graphic novelist and doctor Ian Williams coined the phrase graphic medicine in 2010. In the Graphic Medicine Manifesto, considered to be the preeminent text on graphic medicine, Kimberly Myers suggests graphic medicine, quote, challenges the dominant methods of scholarship in healthcare, therefore offering a more inclusive perspective of medicine, illness, disability, caregiving, and being cared for, end quote. The specific call for the inclusion of multiple perspectives is a key component of graphic medicine. The comic format, with its combination of image and text, allows room to therapeutically explore and potentially represent one's experience on a deeper and more nuanced level than through text or image alone. This multiplicity of viewpoints and experiences potentially insinuates why comics may be an ideal medium for this type of storytelling. Within graphic medicine, complex ideas can be disseminated two ways, through images alone or through a combination of words and images in a manner that is quickly comprehensible. More importantly, if a situation is being represented through both words and images, these two forms can juxtapose each other, conveying conflicting ideas at the same time. The ability to acknowledge both positions at the same time, one in word and the other in image, is a unique feature of the comic form. During his initial theorizing about graphic medicine, Ian Williams considered how the medium of comics, when depicting disease, trauma, or suffering, contributes to the iconography of illness. To Williams, the iconography of illness represents, quote, the bank of available images that inform our collective conceptions of illness and healthcare, end quote. Williams suggests that graphic medicine may not only contribute to this bank, but create new knowledge. The way an artist of a graphic pathography embodies themselves in a comic form is particularly important when their body bears visible marks of their disease or its treatment. They are, in a way, challenging assumptions a reader may have about how the sick live and function within a healthy world. Not all illness, though, makes a physical impact on the body that can be seen on the pages of a comic. In relation to graphic medicine's creation of iconography, Williams distinguishes three specific categories: the manifest, the concealed, and the invisible. In the manifest, signs of illness and/or treatment are visibly scripted on the body. The concealed can be more difficult for an artist to represent, as they are conditions that are often hidden or may not be noticed by a casual observer. The invisible contains any conditions, for example, many mental illnesses, which are not physically present on the body of the patient. Rather, these illnesses are felt by the patient or produce suffering on a psychological level. Graphic memoirs on anorexia provide an interesting case study through which to examine Williams' three categories related to the iconography of illness. Anorexia nervosa is defined by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, as a mental disease, so it would seemingly be classified into Williams' third category, the invisible. However, the phrase significantly low body weight, which appears in the DSM's criteria for anorexia, suggests that this condition of anorexia could be visibly scripted in a graphic pathography, placing it in Williams' first category, the manifest. Further, what is not included within the DSM's definition are side effects that occur due to significantly low body weight. Such side effects are often associated with anorexia, some of which are visible on the body, such as limp hair or sunken eyes, some of which can be hidden, such as the growth of a very fine hair all over the body known as lanugo, and some of which are felt or experienced by the patient, such as extreme fatigue, suggesting, therefore, that graphic memoirs on anorexia could also be considered for the concealed category. I argue that at different stages of anorexia, it is possible for a graphic pathography to be placed in all three of Williams' categories related to the iconography of illness. Further, I suggest that it is also possible for multiple categories to be represented in a single panel. To support my claims, I now turn to examples from one of the three graphic pathographies I examined in my thesis, Tyranny by Leslie Fairfield. While I am focusing my attention today on just one of the graphic pathographies, it is worth noting that all three of the texts I examined were published in the last decade, and the authors of each self-identify as having personally struggled with disordered eating. These factors allow them to be classified as examples of graphic medicine. As one might expect, one of the most obvious ways that Fairfield's pathography is representative of Williams' manifest category is through Anna's changing body shape as it relates to the amount of weight she loses and gains. Early images of Anna depict a female teenage body that would appear to represent what most would consider falling within normal range. She is proportionate in height and weight, and has a slight curve to her chest and hips. There is nothing to indicate that Anna would be considered overweight by medical standards. Conversely, as she begins and continues to lose weight, Anna's body takes on an emaciated appearance. As Anna's anorexia becomes more extreme, so does her appearance. Wavy lines down her back indicate her spinal column and shoulder blades, and her arms and legs are extremely thin and angular. Near the middle of the novel, Fairfield creates a 6-panel spread that effectively captures all three of Williams' categories. A close-up of Anna's face is the visual focus of each panel, transforming over the course of her internal monologue, as represented in the accompanying text of each panel. The manifest signs of the toll of Anna's anorexia can be seen in her wearied expression and heavy bags under her eyes. She confides that her heart is pounding and that she's really thirsty, characteristics which could be considered part of Williams' concealed category, though Anna's opened mouth expression adds to the iconographical representation of the physical symptom of thirst. In the last 3 panels, the reader is offered a juxtaposition between image and text, as Anna attempts to convince herself and the reader that it's all so worth it and she's so gorgeous. The text in these 3 panels not only contradicts the text and image in the previous 3, but also does not accurately represent Anna's appearance. Bags still appear under her eyes, though not as dramatically as in the first 3. Her smile appears forced, seeming to belie what she is actually feeling and thinking, representative of William's invisible category. These panels represent all 3 of William's categories: clear, manifest signs of Anna's illness, her attempt to conceal some of her symptoms from those around her, and a representation of the invisible side effects of the mental strains of the disease. The combination of these 6 panels may prove to be the most meaningful in their addition to the iconography of anorexia, as they could only be accurately and authentically created by someone who has lived the experience of an anorexic, an insider to the community. The intricate relationship that exists between word and images presented across multiple panels as seen here, only possible through the comic's form, is an ideal way to convey both the external and internal causation and effect of a complex disease such as anorexia. As an insider and also a comics artist, Fairfield is able to accurately and authentically convey the experience of an anorexic in a way an outsider could not, thereby adding to a greater understanding and representation of the disease. Graphic pathographies create deeper understanding of anorexia through the combination of image and text, representations only possible because of the graphic narrative format. These stories also add to and enhance both our understanding of and the iconography related to anorexia. It is my sincere hope that my research into graphic medicine and anorexia nervosa may bring greater awareness to the benefits of blending the comic format and stories about anorexia.